you so much.
No problem.
Ms. Swenson,
Hey,
hi.
Jeannie.
I need to obtain laboratory studies to check my patient's electrolyte level. She has a multi-lumen, non-tunneled central venous catheter. Can you observe?
Of course. Why don't we confirm the order for lab tests and gather your supplies, okay?
Okay.
Great. Lead the way.
Hi again, Miss Gitlin.
Hi.
Your doctor's ordered some lab tests for you. I'd like to draw them through your intravenous. Is that okay?
No finger stick?
No.
Oh, then be my guest. I really hate that finger stick.
Okay. First, I'm going to check your ID bracelet. And can you tell me your full name, please?
Sandy Gitlin.
Okay, Miss Gitlin. I'm going to turn off the flow of fluids to the CVAD. Raise you up a little bit. I'm supposed to wait 1 minute, right?
It depends on the facility policy. You should wait 1 minute for standard IV solutions, but up to 5 minutes for total parenteral nutrition, heparin, or any other solution that might alter a lab result.
Okay, we'll wait 1 minute then. I'll pull out my supplies while we're waiting. My heparin, saline flushes. Can I unsnap one snap on your gown?
Now, Jeannie, if more than one lumen is present, draw the blood samples from the proximal lumen if possible.
This white one is the proximal one. I'll cleanse the injection cap and let that dry. Now I'll unclamp the line and insert my 5 to 10 cc's of flushing solution, normal saline in this case. And I'll clamp the line again.
Good. And place the Vacutainer adapter with the needleless cannula into the injection cap.
Okay.
And unclamp the lumen.
Insert the discard tube and snap it in place.
Good. And fill the tube with a minimum of 5 cc's of blood. Remove the discard tube from the sleeve and quickly insert and fill the desired collecting tube.
Now I'll clamp the line, remove the Vacutainer, and flush. First with normal saline. Then with heparin.
Good. What type of catheter doesn't require a heparin flush?
Groshon.
Wow. Very good, Jeannie.
Okay, now I'll just label my tube.
Nicely done. Thank you, Miss Gitlin.
Now I'll just clean you up. You're all set.
Thanks, Jeannie.
You're welcome. Just ring if you need anything.
Will do.
See you later, Miss Gitlin.
Bye, Jeannie.
What time's your clinical tomorrow?
At 7.
Okay, everybody. Good job today. Before we leave, does anybody have any questions about anything?
Well, Miss Swenson, what do you do when you're performing a routine flush for an implanted port and you meet resistance?
So what you're saying is you're unable to push the plunger of the syringe to flush the device?
Exactly.
Well, first, push down on the access needle. And again, try gently to flush.
And if it's still too hard?
Well, if you're still unsuccessful, ask the patient to perform a Valsalva maneuver.
Can you, like, take a breath and kind of bear down? Yeah. Okay, let me try again.
And then repeat.
And
If that's not working, then ask the patient to change position, raise their arm on the side with the port, or raise or lower the head of the bed.
Okay, and if?
You may have to try one or all of these maneuvers. Repeat the attempt to gently flush the port.
Okay, and if you're still unable to flush?
Depending on facility policy, You could remove the access needle and re-access the port using a new needle, check for a blood return, and attempt to flush. Otherwise, you should notify the primary care provider. Be sure to document the problem and your interventions in the patient's record according to facility policy. Anything else?
I have something. You're drawing blood from a CVAD, and after you put the collection tube to the vacutainer, you notice that the blood flow is really slow, or it stops. What should you do?
Well, first, try a new specimen tube. Sometimes some of the tubes are defective. And if that doesn't help the flow, clamp the tubing, remove the tube in the vacutainer, flush the lumen with 5 cc's of saline solution, redraw a waste sample, and attempt to finish collecting the required blood samples.
Okay. Or you could also have the patient change position, right? Have him raise his or her arms or cough.
Exactly. And before Robert asks, if you're still unsuccessful, clamp the tubing, remove the vacutainer and collection tube, flush the lumen, and clamp the tubing. Notify the primary care provider of your actions, as always.
And document the problem and your interventions in the patient's record.
Yes, Robert. Very good. Anything else for today? No?
Nope. All set.
Great. You guys have a good night then, and I will see you tomorrow.
See you tomorrow.
Okay.
I'll stay and help you clean up, Jane.
Well, you guys are...
I'll get that.
Thank you, Jean. Have a good evening.
All right, you too.
Bye-bye.